All right, everybody, I'm going to go ahead and call to order this meeting of the Dunn County Health and Human Services Board for June 22nd, 2023. Call of the roll. I am here. Supervisor Steen is here. Supervisor Hagan, Supervisor Breslin, Supervisor Robinson is excused. Dr. Hall is here. Ms. Rudy is here, and I think Bill Lamb is on. I haven't seen him. We will make sure to mention if he's able to join us. All right. Do we have any public comment, Cassie or Becky? All right. And before I go ahead, Becky, maybe you should take this opportunity to introduce yourself. We didn't have a great opportunity last meeting.
I would be happy to.
Thank you.
I'm Becky Albright. I am the new deputy director. So I replaced Dale Tickler. She retired and is very much enjoying her kayak, and we're very happy for her. So I've been here about a month and still learning a ton every day, but thankfully I have Paula to learn directly from. So I'm extraordinarily blessed for that and just happy to be here.
We're happy to have you. Thanks.
Thank you.
Welcome aboard. And Paula is here and Barbara Fagan is here. And Paula is on vacation. So
I am. Thank you for letting me be here virtually from Kentucky.
well, thank you for being here. We'll try to make it brief for your vacation. Any public comment? Yes, sir. Microphone, please.
I beg your pardon, Madam Chairman. We didn't okay
Yes.
the minutes yet.
That's true. We didn't, did we? Thank you for reminding me. This is the second time I've done that in 2 consecutive meetings. All right. We have minutes from the May 25th, 2023 meeting. I will entertain a motion to approve. Supervisor Steen, Supervisor Hagan seconds. Any additions or corrections to the minutes? Additions or corrections? If not, all in favor, say aye.
Aye.
Any opposed? The minutes from May 25th are approved. Thank you, Mr. Supervisor Steen. Review of the next meeting date, July 27th, regular meeting date. Okay, with everybody? All right, we'll try to see that the doors are open. Supervisor Hagan.
July 27th.
July 27th.
Could I request that we bring cake?
Certainly.
Okay, it's my birthday.
It's, oh, well, absolutely. Definitely cake. Maybe we'll bring other goodies for your birthday. Yes, Supervisor Steve.
I vote against that.
Oh.
I'm gonna be
I don't
gone.
think there's a motion on the floor with cake.
I'll be gone that day.
All right. All right. All right. Nothing from me. So we are going to move along to Greg, Veteran Service. Are you ready, Greg?
I am. Thank you.
Thank you.
Good evening, everyone. I will start off with the memorandum formatted document to go over, and again, just for the group, break it down, local activities, state, federal, and then I'll speak to the financial and later on in the report. So as reported this month, and actually for May locally, a couple things participated in, just a planning meeting with the Main Street of Menominee for a Flag Day ceremony, and then also Evergreen Cemetery assisted with that for Memorial Day. Kind of overall, May is typically a pretty busy month. Just a lot of requests outside of the ordinary, and we're talking about making sure that we honor those that have already left us, and so get a lot of requests, a lot of genealogy calls, a lot of things that are really kind of outside of the scope of what our main performance is based upon. However, customer service wise, we're gonna lend an ear and effort to ensure that we're honoring those requests the best that we can. On the state side, provided some and continuing to provide some mentorship for Taylor County Veteran Service Officer. And again, the reason mentorship is a kind of a main priority of our association's president, which mentorship is always a good thing as far as matching up seasoned staff with those that are just coming on board. And when it comes to positions like ours, there's no mentorship to do your job within a county. There is mentorship to understand the county culture, county activities, vision, and those items. But they've been through, this is their third service officer in about 5 to 6 months. And so there's probably things that can be found on the internet that's public information about some of the challenges overall as a county that they've had there. What our role is, and being our past regional president, now being on our as part of our state leadership, just offering up some mentorship and kind of how this is how we do business, but essentially you kind of set your own business practices to handle things, but within your county's approved business practices. So just trying to assist with that. And I think she's well on her way to get access to all of the VA systems. And basically what it comes down to is just ensuring that veterans that are coming in, that she can get information while they're there, and we can help support submitting things that are appropriate to the VA, because we are accredited. We have all of the right accesses, and as long as the veteran is there, we don't run into any privacy issues. So, and that then helps with that credibility for that new individual coming on board. And budget adjustment has been in process, which is some state funds and approved. Yeah, last night that.
Yeah.
And so the next step is just contacting HR to get the hours added, because the money is going to be used to plus up our part-time position. And then I've included in here, and I'll just kind of draw your attention to a couple documents state-wise, and it's just talking a little bit, talking about service officer grants and state support for increasing that as a whole. If just historically it's been static funding for our particular county, we're only eligible for up to $10,000, or used to be up to $10,000, and that was static for probably 20 some years. Last fiscal year, they increased that for us to be eligible for 11,000, and then they're in consideration for increases where they're doubling it to one discussion, and they're just kind of hammering all of that out. So the likelihood is there might be an increase of about 25%, and that's embedded in those additional documents that I provided. Because it's budget time for the state as well. On the federal side of things, probably the most important thing that we conducted on the federal side is just making sure that we, the one staff and myself and our officer veteran specialists, we're required to do 16 hours of continuing education each year. Probably the most important part of that is ethics training. And the other parts that, of course, is just how to specifically do certain parts of our claims stuff a little bit better. And so we completed that, and our national conference was down in Madison, and typically only one of us goes, and thankfully my veteran specialist has went the past few years, because I try to stay more local because of being involved in some of the leadership at the state level. But good training. Of course, so we completed that, and then just as a whole on the claims side, there's pretty significant backlogs on appeals, and I'll bring some more information next month on I'm in correspondence with Senator Tammy Baldwin's office and their veterans representative based upon an egregious failure, that probably the worst one I've seen since I've been here. And I'm pro VA with the work that they do and what they provide, but so it very egregious error, and there's no way to correct it, because once an individual passes, then everything passes. There's no claim, there's no nothing at that point.
And this
But-
affects one of our veterans.
It does.
All right.
Yeah. It is a pretty significant deal, considering we've been engaging because of how long it's taken. We've been engaging with a congressional rep going all the way back to Ron Kine's office with Mark Alman. And so and they've been involved recently. And so today we just had a quick discussion about how do we correct this to ensure this doesn't ever happen again. And so there's going to be some further discussion, because they've provided some suggestions how this doesn't happen again. And we'll see. And they're motivated, because they agree that this was and they know they don't hear from us. We believe in our office, we believe in handling things at the most junior level you can. They got policies and laws to worry about, not delays in federal benefits. So, and we don't, just as a whole overview, we engage with whatever congressional representative the veteran and family wants. And so we're engaged with, and usually we only have a couple at a time, because we usually try to handle things at our level. They shouldn't have to worry about those things.
Supervisor Steen.
Greg, if it's their error, is it a correctable error?
No. It's the only thing that can be corrected is to fix it so it doesn't ever happen again. Because as benefits stand, if you submit whatever you submit, if you pass away, it ends with you. There's nothing for the estate. However, this was a situation where you can have a substitution of claimant. Your spouse can be a substitution of claimant, and that's what we had. And then the spouse is no longer with us now. So I'll follow up a little bit more on, because it's about action and about solutions and ensuring that this would never happen again.
Well, thank you for pursuing that. That's unacceptable, period.
Yeah, and I on an upside, been doing this 12 years, and this is the one time. So I I'll give credit where credit's due. This is the one time that I really feel passionate about providing suggestions on how to correct this. Other times I think, there's normal wait times. We've got to be realistic about bureaucracy. This was outside of that realistic time frame. So I'll provide some more, because it's an important thing. Yep. So I'll move to the clients served report, and I'll continue to provide the 2022 numbers to compare 2023. The one area that the one row you won't be able to compare is the total pending claims. Last fiscal year, we added that pending claims to best answer. It was one of our supervisors here asked that question, how many were pending every month? So we corrected them. And they
Supervisor
names.
Steen.
But we've got that included. So it'll here next month, and it should be able to follow a better longitudinal piece on that. And with impact statements, veteran specialists just identified two within paragraph number 1, a toxic exposure. You're going to see more and more of those as we come forward. And I really do believe the VA is doing a good job. There's a couple pieces, because toxic, you hear PACT Act, Burn Pit, Agent Orange, Camp Lejeune, all that falls under the umbrella of toxic exposure. And I've seen them even within the healthcare system, they're putting in toxic exposure memorandums. And based upon geographic location where you're at. So they're doing a good job to get ahead of a lot of this. And we're seeing a lot that have been been approved. And ultimately, when some of these good things happen, main thing is that they'll get that health care that they've earned. And the other part is indirectly there can be financial compensation, because the theory is that it's your earning potential is hurt because of this toxic exposure or other injuries within your service in the military. The other one is talk about positive things and correcting things, and the importance of knowing what to look for, reviewing the claims in the process. The second one that I identified there, the individual is no longer able to work, very serious back injury, and then it was exacerbated, and a number of other things. So he's not considered considered 100% disabled, but similar to Social Security disability, if you can no longer be substantially gainfully employed, you can pursue that if those injuries prevent you from this. And the VA tried to initially say that he could work, but their justification was, you didn't prove to us that you weren't working, even though, and so we just sent him the W-2 saying, hey, it didn't work last year. And his doctor's restatement that said nothing's changed from my other statements that he can't work. And they approved it within like a couple days, which is unheard of, which tells you that they understood that they probably made an error in that. That's why I have to look through things closely. So those are the important things. And I would say just highlights that responsibility, not to hastily do things, to make sure we review quality control on both ends, to ensure that we're doing the best we can to help people. So the next item, if there's no questions about that.
Any questions for Greg? Yes, Supervisor Hagan.
Thank you. Just on that last one, I was curious, from when the vet first applied to it and then got denied, what time period was that?
So we didn't, it was probably, the initial denial was probably 3 to 4 months, because my typical approach is to not, I don't like to go the full disability route. I like to ensure that because if the veteran wants to go back, it's easier for them to go get retrained potentially. It's less complicated if we have everything correctly rated, from knee injuries to back to mental health. And sometimes it turns out where there's the total, they determine he's 100% disabled, but not able, not preventing him from work. Because as I identified, really the overall theory is that it's you're kind of lost earnings. Like if you're not going to be as capable as what you might have been in the absence of these injuries. So it wasn't, we went through our due diligence, and he was trying to get back to work until doc said, no more. And then we moved on it. And then it was it was like 4 months. They denied, sent paperwork, because we knew it was going to be approved, and they fixed it quick.
Okay, so yeah, this wasn't anything where
No.
potentially the paperwork of those could have been added in at the beginning. You guys were doing something else before that. Okay.
It was all in the beginning, just the W-2. They're normally you don't have to send a W-2.
Okay.
But they seen that, we gave them information that they normally don't need, just to have them look at it, somebody else look at it. And that's why they got it corrected right away.
Awesome. Thanks.
Yep. So I'll go over the fiscal report, and I do want to give Beata some CFO some credit. Again, we're continuing meeting to go through and discuss, and it's also helpful as we head forward with having our budgets due here in the next couple of weeks. But she likes formulas.
Yeah, she does.
And stuff.
Yes,
Good
she
at it.
does.
Very, very good at it. But but it's very, very helpful. I want to give credit where credit's due, because we kind of went through things, and I had I'd struggled to try to update the projected. And so if you notice right away on the very cover page of this, it looks as if we're going to show at the end of the year, based upon levy and state grants, that there's going to be 18,853 left over. That is not going to be the case.
I don't use it.
It's still, the budget's still gonna be good, but I wasn't able to figure out how to update as I was doing the projected, and we met, this was due before our meeting is usually due. We meet usually the week of our human services meeting here. So that part is not an accurate
Okay,
depiction, because it shows that there's gonna be money left over. We're still gonna fall within budget, but I didn't want it to make it look like next month and I update it, it's gonna show like $4,000 to the good. You're like, what did you do with it all?
a microphone, please.
I guess we could go to Beata then and say that we're gonna be $18,000 ahead, right? Because you're following her formula with her help, so.
I will not throw her under the bus. It's my responsibility.
It's not Beata's fault.
No, but it's my responsibility on that budget, but that'll get updated. And when we look at the budget for the group, we've got 3 cost centers. So again, we're less to keep an eye on, but no less important. So we have a cost center for our, as I'll call our overall operations, salary fringe, and then a small amount for copy paper, things like that. And so we're well within our projected numbers. I don't anticipate any issues there. The other cost center that we have is our Soldiers and Sailors Relief Fund. It's labeled Veterans Relief. And with that right now, it shows that we've got a nice portion remaining. And again, I anticipate more requests for assistance. We've got a few requests in right now, and we approach it, as I've stated before, funder of last resort. We're going to use our partners that also serve veterans that have assistance funds first, before we're going to dig into the tax levy dollars, which is the full Soldiers and Sailors Relief. Outside of, we had some carry forward from last year that's part of that. And then the last cost center is our grant. And I would draw your attention under the Veteran Service Grants. That's on page 2. Midway down, you will see, if you look down the column of the total 2023 updated budget, you will see, or even the budget adjusted and carry forwards, that shows that 15,878 as deposited. It is not, because we needed the budget adjustment approved before we can assign and start spending against it. But it is deposited, and that's what that amount shows in there. Normally, that grant shows 11,000, but the total on that shows as do the math on it. Think about 26,878 is what it will be. And so as you'll see forward here, maybe next month, there'll be some attendance hours charged against that. Attendance hours are for our hourly staff.
Yeah.
So that'll be one thing kind of going forward. 2 things, there'll be update on the projected that will summarize on the front page, and that 15,878, there will be some charges against that for that grant. Any questions about the financial report?
Are there any questions for Greg on financial reports? No? All right.
Okay, thank you.
Thank you, Greg. All right. Moving on to item 8, Department of Public Health report. KT, are you ready?
Yes, ma'am.
There's lots of great information in our packet from KT this time.
Yes, you do have a fairly large packet. I should have warned you. You may not want to print it out.
We'll run through that with Polly.
So sorry. So you'll see in the packet that you have the normal 2-sheeter that kind of just gives you an overview. It has some of the fun pictures that we've collected throughout the month. A couple things that I wanted to lift up, and then you'll also see that there are some support documents in the packet. So public health vending machine. So you see a picture of what that could look like. You probably have seen local media coverage of the Eau Claire vending machine, identical grant, identical idea, except we'll be housing that just as you walk in the door into that public health hallway. Whereas in Eau Claire, they have it in their sheriff's department. So as people are leaving jail, they can choose to use those services. We feel like it's better seated and will likely have more use if it is someplace where public health is in charge of it, even though we do have support from our local police department and local CJCC and Department of Human Services as well. So I wanted to call that out. There's the evidence base behind, so you can see those primary sources and you can see a little bit about what that looks like. Let's see. And so we'll also talk a little bit more about that when the budget adjustment comes forward. I really love the picture in the 2-sheeter of the little doing hopscotch in their brand new bike helmet. Caitlin, when she did that, when she took that picture, she's like, they didn't know that they could take them off, that they didn't have to wear them. We didn't explain that part. And so just a really fun picture to kind of highlight how well that event went. Also Pride Picnic, so second year, able to be out and be present in the community with our new reproductive health nurse. So that's fantastic. And then lastly, we are doing reproductive health and consent and healthy relationship information for 3 of our 4 high schools. We did this year institute a kind of a check-in on what people thought of it, or the students thought of it. And I thought it was just really interesting. You can do the deeper dive into the data, but just the one that's in the 2-sheeter, a third of the students that we talked to had never heard that information. So I think that that is a win. Absolutely. All right. So
Yes, please, Dr. Hall.
So I just want to say, so I did read the whole report,
Hi.
and like, that's just great work by your team that, you know, the students found all of the information presented really helpful, and they felt like they learned enough, and they loved the presenter, and they thought it was really interactive. And I mean, there's always some who say, no, it was boring, but like, that's to be expected. But so that feedback was really positive. And so congratulations to your team. That's awesome.
Yeah, I agree. And I thought including the comments was
Isn't that fun?
helpful. I know, it was fun.
yes, sir.
Is Colfax included? in
No.
that?
So we're re-engaging in conversation around that item. It would be an incredible area of opportunity. We would be happy to do it. But of course, we need to meet the school district where it's at. Okay, so moving through some of the other items in the packet, you also have a report from UW Extension. This was the qualitative data work that we had already talked about. I hope you found it valuable. I know we did. We have put in a request to add an objective to that grant so that we can use the leftover money, about 13-14 grand, to support the initiatives that were lifted up in the qualitative data. So hopefully using that money to rebrand, make sure everything has a QR code, make sure that folks can make their own appointments in the middle of night whenever bit is bothering them, instead of having to call in the morning and talk to a real life person. We think that we can really integrate some of that feedback in a meaningful way. And we're going to start that work, hopefully with approval on the qualitative data with the grant as it exists. So that's good.
I thought it was particularly interesting that people commented that that the entrance to the public health department isn't particularly welcoming.
I did see that. And there was also kind of that divergence where people liked that they could just kind of get in and get out and not be.
And that it was confidential. I know,
Yep.
but I thought that
Yep.
I thought that was an interesting kind of push pull. Yes, Dr. Hall.
I also really resonated with their like it's not clear. Is this WIC? Is this
Right.
reproductive health, the health department, right? What does that
Right.
mean, a department? So that idea
So
of
the
maybe calling
store.
it a reproductive health clinic, having
Yes.
very clear signage so
Yes.
people know, yes, this is the right door to come
Yep.
in. Because this building is confusing and
It is.
scary and
It is.
weird.
And particularly, I think particularly the lower level, it's dark.
Mm,
You wonder if you're in the right spot.
mhm,
So
mhm.
I thought that was insightful.
All very good
Certain people
feedback.
can't get in.
All very, very good feedback. It also resonated with me that, our naming convention was not immediately intuitive. And so you think about Red Door Clinic in the Twin Cities, and that is Hennepin County's reproductive health clinic. That has been in existence for 30 years. They have branded as a clinic. People know what they are. People from our county actually seek services there because they know what they are. They know what they're getting. We can do a better job branding so that we can meet that community need here locally.
Yeah,
All right.
good work. on
Yeah.
that.
And again, 2 nurses doing the focus groups, extension doing the data analysis, and us integrating a quality improvement process that I think is going to be really helpful meeting the community need. So looking at what else is in your packet, you also have a couple of, so at this time we had not heard. So last month I gave you the entire bill. Also, don't print it out. This month I gave you kind of the update as we knew it when the packet went out. Obviously that has been signed into law. What you need to know, the takeaways are that public health emergencies can be issued impacting a business for 30 days and then go to the board for a board approval. I think, any kind of impact to public health authority hurts my heart a little bit, but I do think that we can live within those parameters. And when and if it's challenged because we have a significant outbreak in the state, I think that that's going to be one heck of a trial.
Mm.
All right. And then you also have in the packet, the Public Health Foundational Services. So I gave that to you guys as kind of a primer. We know that we have an award. It's a 5-year award for $158,000 to help us really retool towards Public Health 3.0. And it is really concentrating on those foundational services. What are we doing at a policy, system, and environment level that impacts those foundational services? Hopefully the funding will help us get there. And there is a cost assessment, staffing assessment that's required as part of that grant. So we're going to start that here. We should have already started it, but honestly, we're going to start it when I get back in July, and we have 6 weeks to complete that assessment. And then that's going to predicate the funding and how we use it. It's going to help the whole state really make the argument that if we want to be a high functioning public health forward state, this is where we're at. And this is where we want to be. And here's the funding that goes along with it. Because you guys have heard me talk about how woefully underfunded we are. And this is an attempt to use this federal grant to really quantify that need and that gap. All right. And then something else we'll talk about. Let's see. So that's my report. And then the next item on any questions about that before I jump to 8B on the agenda?
Any questions for KT? All right, go ahead.
Okay, so 8B on the agenda, that's really picking back up on the conversation around using public health ARPA dollars from response, which is really where we have sat with those dollars, using it for things like contact tracing, supporting our long-term care facilities, nursing homes, that kind of thing, to a more recovery focused use. And so I sent out via email a couple days ago a narrative that goes along with that. But then you also have some other supporting documentation. One is a request from Birth to 3 on where they would like to see dollars put. And you'll see the majority of those requests embedded if you add it up in the 2-sheeter that I provided for you. So looking at that item that I sent you, let me just pull it up. That's the budget adjustment. So I give you guys some background on the amount of COVID related dollars that we have had year both from the beginning and currently to start 2023. And then finally, you see what I am proposing moving forward with in a recovery capacity for both the health department and birth to three, and some shared items that we could use together. Any questions or conversation around that?
Dr. Hall, please.
First of all, I think this is really exciting to be able to support birth to three, because of course we all know the importance of upstream interventions to prevent downstream complications. So that's really exciting that that's a way we can use that funding. My question is, and I haven't looked recently to see what the data is, but I know that during the COVID era, a lot of kids fell behind on their immunizations. And so my question is whether we also need to be thinking about funding some marketing, outreach, catch up, any of those types of programs.
And the answer is absolutely. So we know that people stop going to see their well baby checks. They stop going to see their dentist. They stop going to see their gynecologist. So we want to make sure that the services that we provide at the health department are well advertised and that we reduce barriers to those access. So yes, and is kind of where that sits. And so you'll see in the budget that there are some things that I'm keeping back for public health so that we can consider program and service delivery process improvement. And that's really where we want to stand with that. Thank you.
That answer your question, Dr. Hall? Supervisor Steen.
Yes, I don't know if KT or if you could answer this, but would this be coming in the form of a budget adjustment or not?
No,
Doesn't have to go that
no, it
way.
doesn't have to go as a budget adjustment. These monies are already here. This is
Okay.
just an approach to utilize the carryover dollars.
I had a brief discussion with KT and about this, and if you've been paying attention to what's going on in Washington, I would recommend that we'd spend this stuff as quick as we can.
So I would share that we are watching to understand better about what COVID-related funds will be available to us through 2023 and then into 2024, and that is a concern. I don't want to use money just to use money. I want to be a good steward of those financial resources. But we're watching, and hopefully the OMB will present all of the budgetary impacts at the end of this month. That's our hope. And then our national association, both NACO and NACHO, so the National Association of County Officials and the National Association of City County Health Officers, will give us some feedback on where there is impact to specifically local public health, state public health, as it relates to COVID dollars. So we're watching.
Yes, Supervisor Steen.
It wasn't my intent that we should spend every dime that we can lay our hand on without spending it in ways that move forward your what do I want to say, your mission. There you go.
Exactly.
And so I see there are some parameters here about when they have to be spent, and so that's what I was driving at. And if this is if there's a clawback provision in the budget, which is some discussion on, I would prefer that we put ours to good use prior to that. So there's nothing to claw back.
Yeah, I have to say that I'm really pleased with this approach, and I'm particularly pleased with the Department of Human Services and the Health Department working together on an area which is so important and so desperately underfunded, to train the staff, to work with the kiddos, to work with the families. I think this is an entirely appropriate public health approach, and my compliments to you and to Paula for doing this, and to Becky.
Thank you for that. Any other questions or comments on that?
Any other questions for KT?
And you do have the scope of work for the grant itself in your packet if you wanted to wade into it. Okay. And so with no other conversation around that, you do have our financials in the packet as well. So what you need to see in there is that we do show at this point about $67,000 to the good. That is wholly dependent on being able to use grant funds for what they are intended for. And we will have a much better sense of our revenues at the end of this month into next month, because that's when our fees are due July 1. And so I do anticipate that we are going to have we'll come in at budget for reproductive health, but we're still clawing back from lack of staffing. And I do believe that for environmental health, we're actually going to have more than what we budgeted, but I don't want to project that without really knowing. And so you'll see that more next year or next month, whatever timeline.
Any questions for Katie on finances? No?
Thank you.
All right. Moving on to item number 9, the Department of Human Services staff report. To whom am I turning?
You were turning to Paula.
The vacation queen. Thank you
The
for being
vacation.
here.
Yeah. So I put up on the screen, hopefully you're able to see that, my director report.
Mhm.
There's just a couple pieces there that I wanted to point out. Number one, thank you very much to KT for offering public health funding to be able to help our Birth to 3 program and everything that Chair Morehouse just commented about that. I'm super appreciative of that. Also, I was very excited that Cedar Corps finished the environmental report that was needed to be done for the walk-in cooler at Stepping
World's
Stones.
longest.
Yes, it took it, to get that was challenging because, we thought we had it in place and then we found out that no, we needed this. And Cedar Corps really jumped on that and they got it done. And I submitted it. I think it was last Tuesday and Wednesday, I received permission from the Department of Administration that we could move forward with Stepping Stone. So I was so excited to give Pedrick that telephone call to let him know to move ahead, because I know they had been holding their items that needed to be in a cooler at an offsite and having to transport them each time that they held an food opportunity for individuals. So I was really excited that we could get going on that. And then, I really wanted to point this piece out regarding the children's long-term support waiver and CCS caseload, which of course CCS means comprehensive community supports, and really looking at that as how it's going to impact our budget. We continue to increase the number of cases that we have in both of those areas. Now, CLTS is reimbursed through the state for service facilitation. CCS is reimbursed in a couple different ways. We get Medicaid dollars for our service facilitation, and that is billed through Chippewa Falls, Chippewa County, and then we are reimbursed. They do it a quarter at a time, and so that's always lagging in our budget, as you see. But then there's also this portion that's called WMCR, which is a complicated system, but it is a way of being able to bill for time that is not billable to Medicaid. And so our workers, of course, have some non-billable time. So anytime they go to a meeting that there's not a direct service to a consumer, every time they attend a training, every time they take a lunch break, all of those kinds of things. And then that is captured through this WMCR system. The way WMCR works is it's always a year late. So an example, we receive 2022's WMCR settlement in December of 2023. And so, what happens is eventually, as we continue to add additional workers or another manager, which, is out there right now at this time as an additional manager because of the number of workers and that need. What happens is during that time that they are training, their billable hours are not real high, because of that productivity of training and, learning. And then we have to capture that through WMCR. WMCR being a year or year and a half later, then creates this gap in our budget where we are not getting that money until the following year. And we are going to see that gap, especially with these additional workers and managers, because that's a high cost position and a couple new workers in there. That's going to create this time period where we will not have revenue to cover that. We will get it eventually, but it will be in the following year. So it's really important that you have a great understanding of this, because it will impact our budget in that area, knowing that we'll get it later. But like this year, that you're going to see an impact to that, and we're going to continue to monitor that very closely. And so I wanted you to have a good understanding of that. What I'm going to do is stop share and see if you have any questions regarding that or anything else in my director's report.
Are there any questions for, yes, Supervisor Steen?
Paula, then I would take it to mean that this will be reflected in the budget that you're working on now.
It is.
All
Yep.
right.
And well, it will be, because those positions are just getting filled now. They're advertised and getting filled. And so, it will impact us from basically July here till the end of the year. And then also probably the first half of next year.
Thank you.
Do you have any idea, Paula, of the total fiscal impact? It's $1 million plus?
I do not know that at this point, because it's hard to tell how many hours will be billable and how many won't be billable. And so, and then it's also WIMCR. My understanding is there's a WIMCR pot, and depending on how many counties send in the request for reimbursement in WIMCR and what those dollars are, then the state determines each county's amount for WIMCR. And so even if we have expenses, if there's more counties asking for dollars than there is dollars, then that's divided out either also. So it's really hard to know WIMCR until it's actually completed.
Understand.
It's a complicated system.
Excuse me, Supervisor Steen.
Yes, Paula, so let's just assume there's more asks than there are money. Are the asks made whole in the next year then?
No.
All right, thank you.
Okay, go on, Paula.
All right, and so that's all I had for my report. Then I wanted to share the financial report.
Yep.
And get that up for you. So just a moment. Get that up and share here. All right. So here is our financial report and projections through the month of May. This will take us through. We are currently looking at a budget surplus of 147,276 at this time with the projections in. Now, I just shared with you the CCS, so that would be a new expense onto here that is not projected in this dollar amount. In addition, I met last week with our finance department, Beata and Sarah and Jerry, and they shared with Becky and I that our foster care placements are pretty high right now, and we are, at a risk of going over budget in that area. So we need to continue to monitor that very closely to see, what's going to happen with that in the next few months and, until the end of the year. So there's a couple key pieces here that we are looking at that need to continue to have close look at, and I will keep you up to date with that as far as where we are at. And I know that they were working on a document for me to be able to share next month that will show those exact numbers in foster care, so that you're able to kind of look at that data and have that in front of you. I want to recognize that many of you probably have been watching the Human Services, Eau Claire Department Human Services investigation and reports. One of the things that was said in there in my interpretation of it was that was something that was said to the board as the placements were high, and that's why that overage occurred. And I want to make sure that I'm very transparent with you and can show you that data, that I'm not just telling you this, right, that this is something that's impacting our budget, and that you can look at those numbers and have that in front of you, and we're able to then have good discussions about that. And in no way am I saying anything negative about Eau Claire County. Please don't hear that, but I just want to make sure that I'm getting you that information in a transparent way.
Yeah, and you're way ahead of me because I was going to ask if we could have a report on the
Yep.
foster
Yep.
care placements next month, and so.
Yep, they're working on it and said they couldn't get it done by this meeting, but they will have it next meeting.
Great.
Was
Yes,
there any other questions on this?
yes, go ahead.
Yes, Paula, as regarding this last issue and the issue before this, would you say that this is a fallout or a connection to the COVID pandemic that we had, and this is a kind of a ripple effect that's showing up now?
Sure. I mean, I think that one could point to that in many different factors. I'm going to stop sharing just to be able to have this conversation with you. But I think when we look at things that COVID impacted, it significantly impacted mental health. We have seen, spikes in that. You'll see that in our annual report, the spikes with the mental health crisis calls and mental health placements. You will also see that in increased drug use. You can point to the pandemic with those areas because I think it's seen nationally, for that. And with that, those are the cases, the majority of cases that we are getting in the child protection system is parents using drugs and its impact on families. Of course, alcohol too, we are in Wisconsin and there's that alcohol factor as well, which continues, but mental health and substance abuse are, that's the significant factor there. And of course, they're linking that with the pandemic as well as in normal times.
Thank you very much.
Other questions for KT? Dr. Hall, please.
I have a question for
Okay,
Paula.
sorry.
Paula, so looking at just the first page of the budget, I just had a question. When I look at of your financial report, sorry, to be clear.
Sure.
When I look at salary and fringe month to month, it seems to be highly variable, which was just surprising to me. So I don't know if you could maybe speak to that. Are you having huge fluctuations in the numbers of your staff, or if you could speak to that a little bit, I'd appreciate it.
Sure. Some of it is, some months are five weeks. So their payroll weeks are just wonky, and that's why you're going to see a higher number for those weeks. In those things. Yeah, you're welcome. Yeah. And so, we haven't had, as far as our turnover, we've not had a great number of turnover. There's been a couple here and there, but not a great number of that. So it is more of, that,
Payroll.
when the payrolls fall and those kinds of things, we are adding a few staff. So you're going to see that go up here. And but our staff has stayed pretty consistent, overall, when you're looking at the number of staff that we do have in the department, which is almost 100.
Yeah.
Thank you.
Mm-hmm.
Any other questions for Paula? Yes, please, Dr. Hall.
So Paul, I had another question actually it's in those other charges that we review. So that's later in the agenda.
Okay.
So I'll save that for later.
Okay.
Do you want to talk about the report now, or do you want to wait? It's an action. We have it as an action item, though we don't necessarily need it as an action item, but.
Sure. I mean, if you want me to go into the annual report, I can certainly do that. Is that what you're asking, Diane?
Yeah, or if you want us to just go ahead, it's entirely up to you.
Yep, I can do the annual report. So,
Okay.
in looking at the annual report and, being new to Dunn County and, it's going to be a year on July 1st. I can't believe it. I don't know about you, but boy, that time has gone really fast. And I remember my first county board meeting was Chris talking about the annual report for our department. And so this was my first wing at this annual report. And of course, it's a little
Good.
bit different. Each county does things just a little bit different. I felt it was really important that we look at the human in human services and start the report out talking about the people we serve and what that looks like, giving some examples so that you as boards and county board and members of the community can take a look at not only the data, what is our fiscal look, how many people do we serve, what does that look like from year to year, but really what do people look like when they come to our department. And it's really important that you recognize that there are neighbors, there are brothers and sisters and grandparents and, students in school and, all kinds of people that our department works with from birth to death. Gave a few examples of the things going on in the department, but I could have written 20 pages of examples of, the faces of the people that we serve. But of course, I wanted to keep that down to one page. But to me, that's a priority, that you see the human in and really looking at the people count, because those are the stories and work that we do. Of course, we always have to look at the fiscal and the data that comes along with that. So then if you turn to the annual report, page 2, after my introduction, I added the fiscal report. This was not added in previous reports that I could find, but I thought it was important that you got a solid look at the financials for the department. Of course, our audit is not complete yet, so there may be changes to this, because they're unaudited figures. But at this point, it looks like we expended $15,135 or $15,135,891 in expenses. And then the revenues at this point were $468,278. Boy, I can't talk tonight. So, we're still working on some of that revenue coming in and financials, but it's pretty close at this point. And then, certainly looking at the audited section when that comes in. What I wanted to, point out here also is, the end balance of a positive of $332,387. We talked about that throughout last year, but also wanted to point out that 22.44% of our budget is tax levy. That is a pretty low number, I believe, when you're looking at departments and how much tax levy needs to go in there. Out of 15 million, 22.44% is pretty low. And then when you're looking at the overall county tax levy, we use 16.44% of the overall county tax level. So, just kind of wanted to put that out there so that you could see how many grants and contracts that we have throughout our different programming that helps make up for all of those costs. And certainly there is some financial responsibility of people that receive services. So, when you look at our ADRC section, you'll see that the most common payment for Meals on Wheels is $4.10. So you take that times all of the meals, right? And there's quite a bit of contribution in various areas in our budget from the consumers as well. I don't want to take the time for you to or insult you by reading our report, but certainly economic support. When we look at that section, Jessica has been to this meeting and talked really about what the pandemic has done and the changes that are coming, here that have happened in 2023. Our numbers, stayed pretty high in 2022. We're not sure what 2023 will look like with all the reviews coming each month, and if those numbers will start to decline or how that impacts our consumers. But we're certainly continuing to keep an eye on that. when we look, so, yeah, any questions about the economic support department? There's just a lot of data there. There's a lot of money coming into our county, for people to use in Dunn County or, locally, that hopefully infuse our, economic growth as well. But again, any questions on that area?
Any specific questions? Yes, Dr. Hall, please.
I had a question about, I know we've talked before about how the food share benefit amount was going to decrease significantly for most folks using that over these past few months, if I'm remembering the timing correctly. So it's not really germane to the annual report per se, but any kind of notes from the field about how families are weathering that change?
I have not received an update from Jessica on that, knowing that that just occurred and it may take us a few months to really get a solid feel on that. I know that our workers have been trained to be able to provide other resources like the stepping stones and the other food pantries in the community. And I'm interested from hearing from them as well, the numbers and how that will look for them. But knowing that it's going to take us a little bit to get that data, but I'll try to get that for you in the next month, Dr. Hall.
Maybe we should look at that at the end of summer, which seems like a more reasonable time frame to come back
Yeah.
to revisit. So
Sure.
not necessarily next month, but after we've had a couple of
Right.
3 or 4 months of operations to see how that works.
Okay, if that would be acceptable, I think that would give us a better a baseline then of where we're at.
Yeah.
Okay.
Any other questions on that section? Go ahead, please, Paula.
Okay, then I'm going to jump into page 7, which is the Aging and Disability Resource section. In this section, you're going to see, all of the meals that we're providing, the options, counseling, information assistance, elderly benefits program, long-term care program for the entry into the long-term care programs. And so here you're looking at the data of 2,957 requests for INA. The disability specialist had 195, and the elderly benefits specialists serve 553 people. And so those are all Dunn County residents that they serve here. And so that's a lot of people in our community within that age group. And then you look at the meals, the programs there as well. And one area in this section that I really wanted to point out, and I asked Tracy to put this information in the report, which is a little bit different than the previous year. If you look on the top of page 8, it points out the adult protection services and what's happened with the numbers of referrals in Dunn County and in all other counties in Wisconsin, and I'm sure nationally. But the number of referrals that we've received for adult protection and elders at risk. For example, in 2018, we had 184 referrals, and in 2022, we're up to 268. And then you look at the investigations and legal guardianships out of that and protective placements. Again, protective placements is the court ordering somebody into a placement, that they're not able to live on their own any longer. And so you see those numbers as well kind of reflecting there. They're kind of staying in the same zone, but certainly those referrals and investigations have gone up. And one of the reasons I wanted to point this out is in the 2024 budget that we're currently working on is I do have in there a request for another adult protection worker in a lead position to be able to help with that unit because these numbers continue to increase. And we know, I believe I showed you, has it been 6 months ago, maybe, the numbers of seniors or older persons in Dunn County and how that's increasing and, going to continue to increase. And so the adult protection funding is very, very low. And so this, unless that we do get some additional funding out of the bill here, with the legislative bill, this is tax levy and needed for this section. So I wanted to point that out to you. Are there any questions regarding APS, elder abuse, or any of the ADRC sections of the report?
Hearing none, Paula.
Okay. Behavioral health section, on page 8, the first sentence over 1,300 consumers receive mental health services, and it should say in 2022. We've looked this report over, I don't know how many times to pick up details we may have missed, and I missed one there, so I apologize for that. It should say in 2022. Updating those numbers. And so you're going to find throughout this report and reading it that the numbers significantly have increased in mental health and substance abuse, just as I've talked about previously, and the need for those workers because of those issues. And so lots of data there, with the crisis program and all of those kinds of things. So anything else that you have questions on in the behavioral health section?
Dr. Hall, please.
Paula, I have a couple of questions for you. One, you talked about the loss of some of the inpatient mental health beds, and now we only have kind of one facility available to us. But I was wondering, I remember from a previous meeting that, was it maybe St. Joe's was going to be expanding their number of behavioral health inpatient facilities. Is there any update on that? Am I remembering correctly? Or
You are remembering correctly, although I heard, it's probably been 3 or 4 months ago now. I heard that they're from them that they were pausing that and really taking a look at that because of some things going on with St. Joe's. And I don't know if that has changed yet. So I have not heard anything about that moving forward. And so we're
no
just
relief on the horizon?
Right. I've not heard of anything. And so I'll let you know as soon as I do, or if there is
Sure.
potential that moves forward. But the last I heard, it was paused.
Okay. My second and final question is looking at how many residents are being served, both in a crisis capacity and for kind of ongoing outpatient behavioral health services. The question I had, and I don't know if we have this data or we have a way to capture it, but are we meeting the need? So are we turning people away who would like to engage in counseling or psychotherapy or for medication management? Are we having to turn people away? So we're providing a lot of service, which is great and important, but are we meeting the need? So
Right.
I don't know if you're able to speak to that a little bit.
My answer to that is no, we're not meeting that need fully. In fact, you'll see that thank you for bringing that up, because I forgot to mention that. You'll see that in the 2024 budget as well. That is the other position that I put in there that doesn't, it has a mixed funding. There's, different types of funding that can go into it, but it's not fully funded. There is some tax levy into the therapist positions. And we are requesting another therapist for the clinic. What we're seeing is a need for therapy for not only adult behavioral health, but for children. And we're, the number of children that are experiencing mental health concerns, and that again ties back, I believe, to the pandemic, has just continued to increase. And there is not enough providers for children to get in to therapists, as soon as they need to. And so, especially in our children and families unit, where we need to, have that started immediately when we are working with families lost my word. There's just that lapse in providers and ability to get that done. And so we want to make sure that we are moving as quickly as possible to get people into therapy so that we can work on services and move those children back home as soon as possible if we're able to.
Thank you.
Mm-hmm.
Any additional questions? Okay. Is there anything else that you wish to point out, Paula?
So just the children's long-term support waiver, I asked Casey to put this in here because those numbers continue to increase. And you can see that on the chart on page 12. I also know this is another area I just want to mention in reviewing the Eau Claire County report, that many of the services that I believe that they talked about providing to families came from this program. And so I wanted to just make sure that you had the education on this program, that this program is funded by the state, and we receive funding for the services. But what we do is really take a look at what those families' needs are. And I know, Casey and her team really look at what can be provided in a modest approach, for families, and just really identifying that and trying to do that with good stewardship. And so just so you're aware, that there is that look at this, and that we're monitoring that on, to make sure that we are using that funding well. But it is funded through the state for those children that have disabilities, their therapeutic needs. The Birth to 3 program, I believe we covered that really, really well last time, what they do, and, all the services being provided there. So I'm not going to spend a lot of time on that. Next, family and children's service section. You'll see that actually our number of referrals were down in that unit from 2021, from 748 in 2021 to 653 in 2022. And the investigations, what we investigated was 148 of those cases. What we're seeing with the pattern that we're seeing, and this is, continues to happen for the last several years, is the numbers are declining in cases, but the case acuity is higher. So what's going on with families is more complicated, and higher levels of trauma with families. And so it's taking the same, if not more, amount of work from the workers because of these additional levels of trauma and acuity with the cases. But the numbers have been declining in there. And youth justice, juvenile court intake are those children or youth from 10 to 17 that have committed some kind of crime or delinquency or truancy within the county. So you'll see those numbers there. And lastly is the family treatment court numbers, because that is housed in our department. And so you'll see the data there. Any questions that you have for me on those last sections?
Hearing none.
Okay, thank you.
Well done. All right, moving on. We still have printer issues on the DHS vouchers. I don't know what it printed off to. You want to count it? But the bottom line this month for the DHS vouchers is $434,082, $434,082.10. Dr. Hall, you said you had a question.
Yes, I did. So, not that I looked through it all with a fine tooth comb, but right away on the first page, some of the very first rows there, for cost element, it just says procurement card, P card expense, and it's, from Bremer Bank, and most of them are small amounts, but some of them are higher amounts. And I just didn't have any context for what those are for. A lot of the other ones I can kind of figure it out, but those were a mystery to me.
Thank you for asking that. So our staff, several of our staff do have the P cards, which is the credit card, but they call it a P card, is the language that they use. And so like that larger amount is actually in our first episode psychosis program. And so they are able to use that credit card when they're going to a training, for transportation, hotel, any of those kinds of things, meals that go on. And in the first episode psychosis program, part of what they do is integrate people in the community. So they do take people out in the community for activities, for a meal, for, a coffee, those kinds of things. And so part of that, would be some of those types of funding underneath that area.
Thank you.
Mhm.
All right, any further questions about the DHS vouchers? Again, this is kind of our checkbook.
Mhm.
I will entertain a motion to note review of the vouchers for May. Supervisor Steen moves. Is there a second? Dr. Hall seconds. Any further discussion? If not, I'll entertain a motion to a vote, sorry, to approve the to note review of the DHS vouchers for May. All in favor? Aye. Any opposed?
Aye.
Thank you. Thank you. All right. Item 11, reports, resolutions and ordinances forwarded to the county board. We've just heard about the DHS annual report. I'd entertain a motion to forward the DHS report to the county board. Supervisor Steen, is there a second? Supervisor Hagan, any discussion? If not, all in favor?
Aye.
Any opposed? Any opposed? All right. The annual report goes to county board next month. We have a health department budget adjustment. Anything, KT, that you want to note about this? This is our vending machine.
So what I would share is, first and foremost, I was supposed to let you know that Bill Lamb had joined us at about 6:05, and I forgot to do that until he just now chimed in on the vote. So I
I did
apologize.
see that. I was going to make sure that Cassie knew that he had joined us.
So sorry. So getting back to item 11B, so what you're seeing is a grant from the state, 25 grand. It is used for the machine itself and the harm reduction supply. So this is fentanyl test strips, Narcan expressly. We can put other things in there like condoms, but we have to pay for that some other way. So this is just for the supplies associated with preventing opioid overdose.
Any questions? All right, I need a motion to approve the budget adjustment for public health. Supervisor Steen, Dr. Hall seconds. All in favor?
Aye.
Any opposed? Budget adjustment passes. And finally, we have a budget adjustment for human services. Anything that you want to note about this, Ms. Winter?
Sure. The first budget adjustment on that resolution is due to when we budgeted last year for 2023, we thought we had a grant for the full year. The financial unit did, and what happened is that grant actually ended in the end of April, I think it was. And so we need to remove the months from April till the end of the year out of that grant because we're not getting the funding and we didn't spend any money. And, you know, we were aware of that this year. So no money was spent, but it was just cleaning up that budget. The second one was for family treatment court. We received $8,000 more, a little bit over $8,000 more. And then the third one was the independent living supports, which was the ADRC, the grant that we received in the ADRC to help people with that pilot program for independent living.
All right. Again, I need a motion to approve the DHS budget adjustment. Dr. Hall moves. Is there a second? Ms. Rudy seconds. All in favor?
Aye.
Any opposed? Budget adjustment passes. And that is our agenda until we see you next month for Supervisor Hagan's birthday.
Looking forward to it.
Thank you, everybody.
All right.
And without objection, we are adjourned. Thank you, Paula, especially.
Thank you. Yeah, thank you very much.
Bye, Paula. We miss you.
Oh, thank you.